I've taken the floor before to talk about the need for health insurance reform, health care reform. I've talked about the high cost of health care and how we need to get a handle on the amount of resources we spend as a nation on health care. I've talked about the need to improve in prevention and wellness programs. We've talked about the public insurance option and why I think it's so important to have a public insurance option. But today I want to talk about a different issue. I want to talk about what happens if we do nothing. Because I think the people of this nation need to understand that our current health care system is causing huge challenges for the people of our nation. Whether you have health insurance or don't have health insurance, you're impacted by the fact that your options are limited. Let me just give you an example. Maryland citizens will continue to lose health care coverage every day if we don't reform our health care system. There's currently 760,000 Marylanders that have no health insurance today. That number has been growing during this economic crisis, and now 230 Marylanders are losing their coverage every single day. So there are people in our community that currently have adequate health insurance, at least they think they do, but they're liable to wake up tomorrow and find out that because their company has gone out of business or because their employer can no longer afford to provide health coverage for their employees, that they no longer have health insurance to count on. Marylanders have seen an 11% increase in the number of uninsured since 2007. And what does this mean? As the number of uninsured increase, there's more and more cost shifting. That means those of us who have health insurance are paying higher premiums than we otherwise would have to pay because we're paying for those who don't have health insurance. It means those of us who pay our doctor bills or our hospital bills are paying more than we should because we're paying for those who cannot pay their bills, who have no health insurance, who are part of uncompensated care. And it's a never-ending struggle because as we cost shift more to those who have insurance, insurance becomes more expensive, and therefore less people can afford insurance, and we have a higher number of uninsured. And that is happening today. Marylanders with health insurance are paying more. If we don't fix the system, those in my community and in your community that have health insurance are going to end up paying more. The average family premium in Maryland costs $1,100 more each year because of our health care system fails to cover everybody because we have the cost shifting, because we haven't gotten health care costs under control. The fact health insurance premiums for Maryland families have been increasing rapidly over the past 8 years, going up by 64% from 2000 to 2007. Now, Mr. President, whether you pay that premium directly or your employer helps contribute to it, it's part of your family cost. It reflects in the compensation that you would otherwise receive in salaries as an employee. 64% increase for Marylanders since 2000. For family health care coverage, the average annual premium rose from $7,200 to almost $12,000 during that period of time from 2000 to 2007. And for individual health coverage, the average premium rose from $2,600 to $4,100. And if we do nothing, if we fail to enact health care reform, if we do nothing to control the escalating cost of health care, if we do nothing to deal with those who are uninsured and an increasing number of those who have no health insurance, if we don't deal with the wellness and prevention, if we don't deal with medical technology and dealing with a more cost-effective system, then these trends are going to continue. And we're going to see these type of double-digit increases in health care costs, which means more Marylanders, more people in this country will not be able to afford their current insurance coverage. Let me mention one other fact, which is something that we all talked about. We want to maintain choice. That's one of the prime objectives of health care reform is to maintain choice. Choice so you can choose your doctor, choice so that your doctor and yourself make decisions concerning your medical needs, and choice, I would hope, in what type of health coverage is out there to meet your need. Right now, 2 insurance companies in Maryland hold 71% of the Maryland market. For most Marylanders who have health insurance through work, they don't have a choice today. We want to offer more choice so that we can keep costs down. You can tailor a health care plan to meet your family needs. So we can do better. And the current status quo should be unacceptable to everyone in my state, whether they currently have good health care coverage insurance today, or they're uninsured, they're a small business owner, or work for a large company. Let me just give you a couple of examples of stories from Maryland. Let me just give you this one. A constituent named Catherine from Baltimore wrote me a letter. So, Mr. Cardin, I just received my health insurance bill from an insurance company. The premium for next year went from $666 to $968. This is a quarterly bill. We have a high medical expenses and cannot afford this increase. I cannot go to another insurance company because I am high risk, and I've been turned down from other medical insurance companies. I cannot receive medical assistance because they say we make too much. I am 51 years of age. When I called my insurance carrier and asked about the increase, I was laughed at and told either accept it or go somewhere else. When I asked if I could pay monthly, I was told, indeed not. What am I to do? I need medical help, but no one wants to help me. Please, could you please look into this matter and see what you can do for me? This is a person who has health insurance. And if we don't do anything, that person's going to lose their health insurance. And quite frankly, the access to quality care will also be jeopardized. Give you another story about a small business owner, Alexius from Baltimore, who owns a small software production company that oversees IT for the city of Baltimore. He competes against much larger companies for business. He wants to do the right thing. So he has health insurance for his employees. He has 20 employees. And he pays half of the cost for the employees' coverage. Well, some of his employees came in and said, look, can't you help us with family coverage? And he would like to provide family coverage for his employees. He just can't afford to do it and be able to compete against larger companies. He goes on to tell me that his premiums are increasing much faster than what's happening with the larger companies he has to compete against. He doesn't have the options that the larger companies have. Well, the status quo discriminates against small companies and their health care plans. What we need to do in health reform is to deal with these issues. And that's why, Mr. President, I come to the floor. I know that there's different views as to what we need to do with health care reform, but I would hope that the one option that would not be on the table is the status quo. We cannot let the Catherines of our community say that we're not going to do anything to help you. We got to listen to the Catherines who are telling us, look, get a handle on what's happening with health cost, whether we have health insurance or we don't have health insurance. Get a handle on helping those who don't have insurance so that we don't have the cost shifting that goes on, that we can provide quality health care for all, that we can bring down the cost of health care in our community. Or listen to Alexis, who says, look, help the small business owner do the right thing for their employees. Help bring down the cost of health care. So, Mr. President, I just urge my colleagues, we can have a robust debate as to what should be included in health care reform. But I hope at the end of the day, we will listen to our constituents and provide the type of reform that will allow for people in our community to have access to affordable quality health care, make health care costs manageable, bring down the cost of health care, provide prevention and wellness programs to keep people healthy. If we do that, then I think we are really listening to our constituents and will help our economy and help our nation.